Welcome, friends. Welcome back to the session 5. Uh, if you remember, we had discussed about facilitation skills in the last session, but a part of it was left to be completed. So we will be first spending some time discussing about facilitation skills briefly, and then we will move on to the next topic, which is understanding patients' expectations. So I thought that we must talk about what should be the qualities or the attributes of a effective facilitator, so that we all either identify that we have it, or in case if we think that we don't have, but we have to cultivate that, we have to really bring that us in our approach to make our program effective. So if I request you to write in the chat box, what do you think are the personal attributes you think that are important for anybody to be a good facilitator? Write in the chat box, please. Wonderful. Listener, absolutely. One has to be really good listener. Ready to adopt. Yes, flexibility is very important. Again, active listener, very good. To listen well, accept feedback and patience. Wonderful. Again, conflict resolver. Yes, a lot of time you will come in a situation where there will be conflict either with you or between the participants. So you really have to be good at handling conflicts. Yeah. Communication and flexibility. Yes, I agree completely. Good communication skills. Yes, only thing is it's little broader term. I would expect more specific quality that we would, want from the communication. Of course, good speaker, good orator, good command on language. I think these are very important skills. Body language, yes, one should be aware of the body language. First, knowing your own body language, and also be able to read others' body language. So that means deeper understanding of body language, of verbal, non-verbal, facial expressions, eye contact, not maintaining eye contact, or stiffness of neck, the way we see everything communicates. I think we have discussed at length, and yes, definitely that's required. Good listener, good time management. Yes, Raminder, I completely agree. I think time management is one thing one has to really, really, be excellent at, and that makes you a very, uh, impactful facilitator. Eye contact with the participants. Yes, again, using non-verbals to your advantage. Absolutely. Leadership. Yes, you are navigating the group, so it's always good to have good leadership qualities. Able to establish rapport. Yes, good understanding. Ready to accept criticism. Yes, a lot of time you will get feedback in the more like criticism. So one has to really have a lot of patience to, not only accept but be to learn to be comfortable while being uncomfortable, because criticism is not a comfortable situation. But if you can excel at that when you get a feedback, so immediately reacting and retaliating, instead of that, if you have patience and you just try to find out from where is it coming, is it with the intention just to criticize you, or maybe there's genuine feedback, maybe it has come out as criticism but it actually requires, that needs to be changed. Both ways it can be very, very helpful, but yes, it's very difficult to accept criticism and also work on it. Then observation skills, absolutely very important. Verbal, non-verbal language, if you have to be really excellent at. Have in-depth knowledge, subject expert, absolutely no substitute to this. No, you cannot talk on a stage if you don't have good subject knowledge. Then of course, ability to use different pedagogies, very important. I think that's one thing I'm repeatedly saying, that we have to use minimum of presentation. Least you should use, maximum should be discussion and asking your participants to come up with their thoughts, and then guide people with the questions, then providing solutions. Yes, absolutely wonderful. I think so we have got wonderful feedback, and I think more or less it covers everything that I have thought would come in the category of personal attributes that will really help. So I personally feel that I think as a facilitator, most important thing is you have to be enthusiastic, passionate, and committed to your task. If you're doing it for the sake of doing, trust me, it is visible. If you're not interested and you're doing it, it is visible. So please remember, you are the engine of your program. And unless you are convinced with what you are talking and how it is going to really benefit your audience, you will never be able to convince your audience to accept what you are saying with confidence. So you have to be thorough with your subject knowledge and also enthusiastic and passionate about it. I think, especially if I talk about healthcare communication or quality, people who are talking about quality or infection control or patient safety. So these are, little off the clinic topics. Clinicians are happy with their topics, even nurses are happy with what they learn about nursing. But when you talk about these things, people are not very keen. So one, you have to be really very passionate about your whatever you are working on, and then of course, have good subject knowledge and be enthusiastic so that you can actually influence your audience accordingly. Another thing that some of you have written, that you really need to have patience and tolerance to ambiguity. So please remember, initially, every program, every session will appear very dicey because you will be observing people's body language, which will not be clear cut. Yes, I agree with you. Yes, I am happy. Yes, I'm enjoying. Yes, I'm liking. You will not get this response. So be mentally ready for it. Every time I start my master trainer program, first 2 3 sessions, I see couple of my participants with just uh, I don't want to use black face, but then they are neutral. You can't make out, are they really liking it? Are they really finding it useful? Are they really considering it worth their time? But then you have to be, you have to have that patience and also tolerance to ambiguity. Initially, there will be, I think I shared in the last session also, that in one of the program where I was doing the session for support staff, housekeeping staff. It was Malviya Nagar Hospital, I remember. One of the participants had very blank look on his face, and I felt that probably he's not liking what I'm delivering or saying. And in the end, he came with almost like teary eyes and he said, Ma'am, nobody spoke to me about this for the last 25, 30 years, and I've always been very rude and aggressive with my patients. So, I mean, you don't have to lose patience. Have faith in your work, have patience, be tolerant to ambiguity, and give your 100%. Give your 100%. Trust me, at the end of the session, you'll be able to turn the tables. But then you really need to have that patience to stick to your to hold the fort. Another important thing that I want to tell all of you to be ready for. Whatever you have written is excellent, but these are new inputs that I'm giving you. Please be open to new experiences and new people. One, as a facilitator, you will be meeting a lot of new people every day. For example, if I share my initial experience when I did 500 trainings for Delhi government hospitals, 35 hospitals every day I used to visit a different hospital, different set of audience. Only the organizers were same in each hospital, but the audience was every time different. You will receive different welcome, different acceptance, different participation. So you have to be mentally ready for that new experiences. So training will take you places. You will be traveling to India, across across the globe. So be mentally ready, be open to meeting new people, new opportunities, and lot of opportunities will come your way if you start working on it a very, very serious manner. So one needs to be really very proactive at making connections and building rapport. Don't wait for your audience to come forward and say, "You, thank you so much. You are doing an excellent program for us." So you will have to be proactive, genuinely proactive in building rapport with people. Make effort to connect with people, talk to them, and be nice and kind and open to discussion. That will automatically make your audience also comfortable, and you will also become comfortable. So if I share one of my experiences where I was called by Delhi Secretariat to do a session for all the medical superintendents and deputy medical superintendents of all those 35 hospitals. So for me, this came as a very, a new opportunity, something I had not expected, very honestly, because I didn't know that I was doing a job which was very, really liked by people. But when I entered the room, there were around 50 people in the conference hall, and all of them were like, "Who is she? What is she going to teach us? Why the hell are we? Why the hell are we here? And we have been called from our hospital, leaving our work. We have come and sitting here." So all through this session, I could see that mixed kind of reaction coming from them. But then whatever I was asked to do, I did with best of my ability. But the best outcome of the meeting was, or the presentation was, when I went to their hospitals. Their attitude towards me and my program had completely changed. They were very receptive, very respectful. Personally, each one of them came to introduce me to the audience. Otherwise, they never cared who is the trainer and who is coming and delivering the talk. So that's how you have to be, you have to hold the fort, and you have to be ready to be to accept that people may not easily accept you. One of you had written about flexibility. I think flexibility, both at the cognitive level and at behavior level, is very, very important. So, real situation of training could be very different from what you expected. Does that happen? Those who are into training, you expect something, you go there, and the situation is very different. But again, if you are flexible, you won't take more than few minutes or seconds to quickly see what can be done to make best use of whatever resources are available. A lot of time they are not ready. Sometimes their projector is not working, sometimes their mic is not working, sometimes their sitting arrangement is very hopeless. Of course, if you check all these things beforehand, you can actually see things are available and they are in working condition. But in spite of all that, for example, there's no electricity. So that is something in nobody's control. Or for example, suddenly projector stops working. Happens. Mic is not working. And these things are very, very common. So real situation can be very different from what you were expecting. But if you are, cognitively flexible, you will be able to sail through any situation. A lot of time I have experienced, such situations where everything is just opposite to what I was expecting, but then you can't say, okay, I won't do the training because I am not getting what I wanted. But that flexibility, and not only that you have to be flexible, but you have to actually demonstrate that see, this is how even patients would patients or families might behave with you, but you have to learn to really behave with them in a more professional and apt manner. So that's how you demonstrate your ability to them. Then I think India is a country of diversity, and we have cultural differences, different cultural practices. As a trainer, as a facilitator, I think it's very important to be ready for those kind of cultural differences. So, cultural awareness in what culture, what is practiced and preferred, will help you to be mentally ready for that kind of. For example, if you're going to a hospital which is probably little remotely placed, and you intend doing some activities where the participants have to hold each other's hand and then do some physical activity, there may be a possibility that the female healthcare providers are not very comfortable holding hands of their male colleagues. So we have to be really mindful of all these cultural practices and be non-judgmental, because we can't say, what is this, it's not a big thing, it's a small thing, or you are working in a hospital, don't you touch patient. But no, we can't be judgmental, and we can't condemn or disrespect their practices. And also, like for example, when you will do online programs, you will come across participants even from other countries. Again, we have to be aware of what practices they have. Even healthcare delivery system can be very different for them, different from us. We have to be again prepared for that kind of discussion also. And if you are appreciative and acknowledging the cultural difference, trust me, they will be happy to have you as a faculty. Another important virtue or quality that I would recommend to all of you is empathy and compassion. See, your audience will have their own set of personal and professional challenges. We don't know where they're coming from, what their work conditions are, especially if you're going to a different hospital where you don't know what the practices are, what challenges they are facing. As a trainer, as a facilitator, you need to be empathetic to your audience. A lot of time we recommend something or we preach something that they cannot actually apply. Like for example, if you will teach assertion to your nurses or to your housekeeping staff or your support staff, maybe the hospital culture does not permit even assertion, and it is taken as a being aggressive or being rude. So you really have to understand that what challenges or situations they are facing could be something we are not aware of. Rather than condemning or criticizing them, I think we need to work closely with them and see how we can help them handle the existing situation. So empathy and compassion as a facilitator are very, very, important skills. So a lot of time when I receive personal messages that I will not be able to attend the class because of this reason, and if I know that person has been regularly attending and is very, sincere and serious, I understand there must be definitely a reason why this person is not attending. Of course, if somebody is regularly doing it, then I always tell them that I think you have your priorities, and I think it is better you discontinue and join the next batch when you have time. But then that's a very essential skill. Another important quality or virtue I would want to recommend to you is honesty. As a facilitator, as an individual, as a healthcare provider, as a team member, as a team leader, if you are not honest, trust me, people will not trust what you are saying. What I'm saying, if I'm not practicing in my professional and personal life, it comes out. It comes out, and it's like you're faking. So, as a facilitator, you have to be honest. See, we all have shortcomings. We all have lacunas. Nobody's perfect. Admitting that yes, I don't know, or yes, I have not seen this, sorry, I need to read and come back to you. Even these are good ways of being honest with your audience. We can't have all 100% of the knowledge, and especially every few days, the somebody was telling every 24 hours the information is doubling. I don't know where we are going and what will happen. It's going to be a information bombardment in the time to come. So we can't expect anybody to know 100% of it. Be honest and say that I have not heard about it. Let me read and come back to you. But honesty is a very important virtue. Another virtue that I want to recommend to you to be a good facilitator is sense of humility. Please remember, even a small amount of arrogance and overconfidence can destroy your very well run program. I don't want to be talking about one person here, but that will give you a good example. How many of you follow Vivek Bindra? Nobody. So Vivek Bindra is a motivational speaker, and he has a highest number of followership on YouTube. His programs are watched, by millions of followers. Especially he delivers program in Hindi, so he has a lot of followers who understand only Hindi and they really enjoy. And he talks about business strategies and otherwise, like recently, unfortunately, probably he had a fight with his wife, and he physically probably abused her or something. So that news came into in the it was all here and there in social media. Imagine the damage it must have done to his reputation. I'm sorry, what has happened? Okay, sorry. So, I mean, so we have to be very careful about how we conduct ourselves. And again, as I said, honesty and transparency. If that's there, you wouldn't be scared of anything. You will be honest and saying that, yes, this is what it is. So we have to remember that we don't have whatever we have, it's all grace of God, and nothing is permanent. So having an attitude of gratitude and being humble, I think it opens so many unexpected gates and opportunities that you cannot imagine. So we really, really, genuinely need to be humble and kind to people, because any amount of arrogance will actually bring your reputation down. Another important virtue that I want to recommend is sense of humor. As a trainer, as a facilitator, if you can use humor in your programs, you can actually send your audience very, very happy. Of course, it's a very difficult skill to learn because it can overshoot, it can misfire. So you have to be careful. But the safest thing is never laugh at others. You can laugh at yourself. Have courage to laugh at yourself. Admit your mistakes. If you say, "Oh, I was silly not to have understood this," or "I was so, naive to do that." I mean, you are talking about your vulnerability, which is okay. But of course, we have to be very, very respectful towards the audience. I mean, they may get offended. So we have to be very careful when you're using humor. It should not be targeted at any person. It shouldn't look like being targeting anybody. I mean, though you may not be doing it, but somebody might feel that I have been targeted. Another important virtue that I want to talk about is personal awareness. See, we all have plus and minus, good and bad, strengths and weaknesses. Knowing about what your vulnerabilities are, what your weaknesses are, your hot buttons, what triggers you, what upsets you, what puts you off. It's very important to know them. And if you will sit and reflect, Simil, your face is not visible. Can you shift the camera? Simil, I'm talking to you. थोड़ा सा कैमरा हाँ सामने आ जाओ दिखते नहीं हो साइड पर चले जाते हो यस थैंक यू सो know about them, work on them, reflect. Somebody said something, you felt bad, you became aggressive. Come home, work on it. See how next time I can work and make sure that this does not happen. So personal awareness is another, it's a journey, I would say, that you really need to, walk on because that's the way to improvement. Nobody is perfect. Nobody is perfect. Everybody starts from zero and then one and two and then 100. We are all on the same journey and we learn from each other. So these are a couple of, virtues I thought as a facilitator, we must work on. And that will really make you a very successful facilitator. Anything you want to add other than what has been pointed out or what I have discussed?
Ma'am, encouraging
Yes,
the team, the participants.
definitely. Definitely. I was about to talk about that in the next part of the session, and that was what are the tips to effective facilitation. So ultimately, we want to make sure that the whole program goes very well. So first thing first that I want to tell here as a way to make sure that your program goes well, always ask open-ended question, ask people to answer, give them opportunity to speak, especially those who are hesitant to speak. Ask they therefore see a lot of time. I ask you to write in the chat box so that I get a lot of responses. If I just asked you to answer by unmuting your device, maybe some of you will unmute, but others will be just quietly listening. So therefore, I always say write in the chat box. So encouraging people to participate is very important skill. And for that, you have to create safe space for them. Because why do you think people don't speak? Why
They
do you
may
think?
feel that I may be wrong. I should not be humiliated that this person doesn't even know this thing.
Absolutely, absolutely. So you really have to create safe space. One is, of course, by talking about the group rules. So if you remember in session one, I said that everybody has knowledge, everybody has experience, give chance to others to speak. Please feel free to answer. Even if your answer is wrong, it's perfectly all right. This is the only program where you can give wrong answers. I normally say this to my participants because I know you may not exactly know the answer, but you are trying to answer that itself is more than enough. So ask open-ended question. When they answer, even if the answer is wrong, thank them for answering, for trying to answer. And then of course acknowledge their answer, appreciate that they made an attempt or if their answer is right, and then in that listen attentively. Many of you have written listen attentively. Listening is a very good skill, very important. Sometimes some participants speak very in a very low volume, you may not hear, but then you have to make sure that you are able to see that somebody is trying to answer, and then you tell that the person who is usually when you will hold program, the front benchers will take your attention. So you'll have to really use this technique by saying, see, I know my front benchers are ready with their answers, but I want to give chance to my other set of participants. So you're not telling them enough is enough. You are really talking a lot, but you want to others to talk. But you say, okay, I know you have the answer. I want somebody from the back bench to answer. So you are engaging them. And when they speak, listen to them attentively and see even if it is partly, okay, encourage them by saying, yes, it is great. So as I was saying that creating safe space is very important. So when you want to create safe space, you try to create a supportive learning environment. So encourage participation, encourage engagement, ensure psychological safety. See, we are always scared that somebody might laugh at me. Unfortunately, many of us must have experienced this when we were kids. Teachers would actually, embarrass and humiliate students who give wrong answers. And they'll always appreciate students who give right answers. And when teachers shout at a student, other students laugh at that child. That kills that student's self confidence. So make sure that does not happen with our audience. Even if they give wrong answer or incomplete answer, we have to ensure that they're participating. Another important thing is watch their non-verbals. From non-verbals, if you can make out that they are uncomfortable or they are not, especially in a lot of hospitals, we have seen they'll say, make doctors, nurses, and other staff sit together and attend your session. Happens. So, do you really expect nurses and non-medical support staff to speak in the presence of doctors, and especially if the doctors are seniors? It's not practically possible. So we have to be very smart at picking who is going to sit with whom, so that they speak. But if that's the situation, you will see in their non-verbal that they are not really able to speak. Again, in the group, you have to be mindful of the group dynamics. So what kind of group dynamics have you observed anytime if you have done a session or you have been a participant? If somebody wants to unmute and answer this. So have you ever observed that the group actually breaks down into two groups or multiple groups?
Multiple groups.
Yeah. And especially if there are mix of healthcare providers, doctors, nurses, and other staff. So you have to really you have to keep an eye on this. So for a full day program, for example, if I know I'm doing a full day program, I would know everybody prefers sitting with their colleague with whom they are comfortable, but you want to bring them together. So what I do normally for them, I will have, I'm suggesting a couple of activities. So what I do right in the beginning, I will give uh, say, for example, if there are 30 participants, I will give 15 questions and 15 answers. So all questions I will distribute in one set of participants, and all answers I will distribute in the other set of participants. And then I say, okay, look who has your answer or who has your question. So automatically they will have to sit with the person, and then I say, okay, spend 3 minutes and take each other's introduction, and then you have to come and introduce each other. But that I normally do when I have 1, 2, or 3 days program. There I can spend 30 minutes on doing this activity, because the idea is they must gel well with each other. So that's one way I normally do. So if you remember in one of the activities on building rapport, I made you sit in the breakout room with one partner so that you could converse. So that's how you have to break the ice and make sure that they gel well right in the beginning. But even during this session, if you can see some kind of disagreement or some kind of conflict, you have to be really really watchful of that, because this can escalate and go wrong. A lot of time, one of the audience member can disagree with you. How do you handle that if somebody wants to share their understanding? Suppose if one of your audience member is not agreeing with you.
We need to respect that person. At the same time, we need to take the opinion of other people also. And we can say that here's different situation. You may have different ways to handle, but this is what is usually done.
Very good. So, honestly, to start with, never negate uh, the answer that the person is saying. Because the moment you say, no, 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 what you're saying is not possible. Well, I don't think that happens. So, what you are saying, no, you're wrong. Maybe if you think the answer is completely wrong, okay, I appreciate you answering. Let's ask, what do others say? So, usually the group, when they disagree, the complete anger that would come to you otherwise can be diffused by directing it or redirecting it to them. But one has to be really very smart in handling the disagreement. I can share one experience. I think I told you, all of you, that I attended that Dale Carnegie program once, just because in one of these sessions, there were members from the Residents Welfare Association, and they completely, for a few minutes, they hijacked the session before I could get back the control. But then I went home and I said, "What is this? I can't let this happen." So I have to, work on my ability. And then I did that Dale Carnegie program. After that, in another government hospital, it was a program purely for doctors, residents, and above. So one of a very senior consultant, right when I put my laptop and the first projection slide was, visible on the screen, the title of the first slide was Importance and Relevance of Communication Skills in Healthcare Industry. And this gentleman, who was a retired professor and was now consultant with that hospital, he said, "How can you call healthcare industry? Healthcare is not industry." Now, had I been my old self, I would have fought tooth and nail with him to prove how we can call it healthcare industry. I said, "You don't think it's the right title? No, no, no. You can call it healthcare industry. Thank you so much, sir, for your feedback. I'll definitely consider." And I moved on. Trust me, there were 35 doctors sitting on the edge, not in my favor, because they didn't know me. They would have been very happy had they seen me arguing with that professor. I did not get into any argument. So very smartly, you have to pick your battles, because you can't unnecessarily get into argument and spoil your. Because I knew I'm not here to fight and argue for the title of my program. I'm here to deliver something. I have to deliver a message. And then everything went well. Everybody was very happy. But then you will come across situations where people might even find, any fault in what you are saying. So you don't have to fight over everything. Pick your battles and handle very, very carefully. Now, coming to a very interesting topic, and that is managing disruptive behavior. Because a lot of time, give me 1 second. Give me one. Okay. So first of all, we are 11 of us. Why are your videos off? Except Dr. Parmeshwara, I think I request everyone to have your cameras on, please. Okay. So a lot of time we come across, audience who are very disruptive. So anybody would like to share their experience? Dr. Som? Well, I'm sure you are into teaching and training. So have you had an experience? Although I think students would not dare make it difficult for you, but have you had any experience where you're?
No, I think I deal with adult learners. So it's many times it's going to be a disruptive behavior. It's like, especially when the learners are not interested in learning, they want to walk out, or they have some other agenda that doesn't resonate with the agenda of the class. Then it becomes really difficult. And if I allow that learner to walk off, then the others will follow the lead.
Yes.
So you cannot allow them out of the class. At the same time, I need to make them sit in the class and then contribute for the class. So what I do is it's like take them onto my onto my side. Mm-hmm. For example, I'm an anesthetist. So if I'm teaching in central line on a mannequin, mm-hmm. and that guy is not interested because he knows how to put a central line, I'll invite him. Why can't you demonstrate the central line insertion to all other trainees so mm-hmm. that let's all learn from you? I feel you are very good in putting a central line. Mm-hmm. And then the disruptive learner will become a teacher or a facilitator so that it becomes very easy. Then I will be the assistant for him, guiding him and then correcting him as and when he does the procedure. So that's how I lead the class so that the disruption is not an actual disruption. Yeah.
Wonderful. Excellent. Thank you for sharing that experience. Anybody else who would like to share their experience? Anu, I think you are also in training. So would you like to share your experience?
Till now, I didn't got any destructive behavior person as of now because we deal with the doctors only. But I think when there is a group of mixed groups are there, like nurses mixed with the doctors, when we teach basic skills, some doctors say that we already know and you are just wasting our time and all. So at the same time, as Dr. Som said, we'll ask them to demonstrate and we'll ask them to teach their own nurses. So they will be engaged and they won't be creating any fuss there.
Wonderful, wonderful. So yes,
if I can contribute. So,
sure.
being an anesthetist, I used to have lots of disruptive surgeons. So, especially when there's a crisis situation occurs, then the surgeon panics a lot, and then rather than helping us to contribute to the patient safety or welfare, they start asking questions. What's happening? Why did you do this wrong? This anesthetic is totally wrong. So what I do is I normally tell them that the patient is hypotensive, or maybe the patient is in cardiac arrest. So I think you are the best person, since you are already at the operating site. I would like you to do chest compressions, so that I will delegate the task to him. So if I delegate the task of chest compressions in a cardiac arrest setting to the surgeon who is disruptive, he is also in having the best interest for the patient. So he will contribute to patient safety. And at the same time, since he is busy in doing chest compressions, I can lead the team and delegate different tasks to other members so that the problem is mitigated, patient is saved. And then later on, when we sit and debrief, then we will talk about our emotions and reactions that have happened during the crisis, and then we will come at an amicable solution. What can be done in a better way when we come across the crisis at a later time? Yeah. Thank you.
So see, this requires a lot of patience, confidence, and then also control on your emotional reaction, because usually we get overwhelmed and we also start reacting. But you really need to have a lot of good emotional control so that you don't get carried with the situation, but you stay, focused on what you want to work on. Absolutely. Thank you so much. So I think we'll do a very interesting activity. Anybody who is willing to, talk for 2 minutes on any subject of your choice, preferably what is the importance and relevance of communication, or maybe some experience that you want to share. Anybody, please volunteer. Dr. Bijoy, will you participate? Karo bhai.
What I want to do?
So I will give you 2 minutes time. I'll give you first 30 seconds to think of a situation or talk of a situation that you have encountered in your workplace that you want to share with your colleagues here in the program. So, and I'll put you in the waiting room for 30 seconds, and I'll bring you back. Is that okay?
Fine.
Okay. So I'm sending you to the waiting room. Yeah.
Ma'am, situation related to communication.
Anything that you want to share, because I'm giving you suddenly some topics, so I don't expect you to be ready with something. You can share your experience of something that you handled very well. Is that okay, Dr. Bijoy?
Ma'am, is it something which I handled well, or is it something which I repent, or I think I could have handled it in a different way now when thinking after sitting in class?
You have the freedom to choose whatever you want to talk.
Okay, fine.
Okay, I'm putting you in the waiting room. Okay, friends, sorry again for the activity, but that's the activity. Bijoy is going to talk about his experience, but you don't have to allow him to speak. You have to disrupt. So somebody will have to ask nasty question. Somebody will have to start talking on phone with your audio on. Somebody will have to, just interrupt in some way or the other. Are you ready?
Yes.
Okay. So I'm admitting Bijoy. Yes, Bijoy, are you ready?
Yes, ma'am. I think
okay. Go ahead, please.
Yes. Last week, actually, I had a.
Yeah, hello.
When?
Yeah. What I wanted to just say is, please explain again. Hello. Yeah. I can't come back to you.
Yeah, Vijay, you can start telling us. I'm listening all yours.
Yeah.
Yeah.
Okay.
We were talking about something that happened last week, right? What
Yes,
happened actually?
I'm getting one more audio disturbance.
Oh, okay.
You
I
continue
think
now.
yeah.
Then you can continue. You can please
You
speak.
can continue.
You can continue. We will all listen. I think
We
it's okay
can't
for
wait
us.
like
So,
this.
yeah.
Yes, sir. Last week when I was in my
Hello.
Dr.
Yes.
Bijay, your
Hello.
camera, I think there's something behind you're sitting,
Yes.
something disturbing.
no, I think
No, I
it's
think he has
There's
put his
something,
screen in a blur
some
mode.
disturbance I'm getting.
Yes,
Something like that. I think now you should be okay.
I think it's fine now. Can I
Yeah,
continue
can you
now?
can you continue?
Am I audible?
Can you
It's
continue?
fine now.
Yeah,
I
you
think
are audible. I think
Yeah,
it's
you're
clear. I
Voice
think
is
some
breaking. Voice is
disturbance is
breaking.
there in the audio. Yeah.
Shall I check it once more? I'm so sorry.
No,
Yeah,
no, but
wait
your
1
voice
minute.
is
Yeah,
breaking, it
please.
seems.
Just
I
call
cannot
me
hear it
later.
properly.
Yeah,
You
please,
were
can you
about
call me a
to
little
share
later?
something, Dr.
Okay.
Vijay. You can.
You can start, Dr. Bijay.
Yes, can I?
Please start. Yeah.
Please
Yeah,
start.
last week in my OPD when I was sitting and I was
One
explaining.
minute. I think somebody
Again
wants
you
to say
called me,
something.
no?
1
Just a
minute.
minute. Just a minute.
Hello.
Just a
One
minute.
moment. Hello.
Vijay, pardon me.
Yeah, I understand. That's
I-
fine. Good.
You
It was
got
fun.
it.
I was trying to play along. Actually,
I know.
I did well.
Thank you. That was just to give you a feel of how you feel when you have audience who are not interested and who are there just to trouble you. But Dr. Zag, you joined just now. We are discussing about how do you handle disruptive audience. So there will be audience who will not be, not only interested, but also they will disturb your session and they may even hijack it. And it's as a facilitator, I think this is one thing we have to learn. If you can manage this, you can manage anything. So I think Mr. Vijay Rai was constantly on phone, and he was the one who disrupted maximum to your.
Ma'am,
And
he
As-
did his job
as
pretty well, I
discussed.
must say. He was so natural. Seriously, I'm saying.
Thank you, Dr. Vijay. Thanks.
Sorry, it was on my request that everybody was disturbing you, but that was just to give you a feel how you feel when people, don't behave well or they don't know how to conduct themselves in the program. And don't think that this is something you will not come across. A lot of time you will have on online and even physical programs, especially people if they are from a higher, higher in hierarchy, they would think it's perfectly all right to have their ringtone on or to take their call in the session or do the talking. So these are very common things you will come across when you will have programs for your healthcare provider. So we can categorize these disruption in 3 degrees: low, and then medium, and then serious one. So in the low degree, you will see people who are usually quiet, who would not speak, but they'll be, they're not connected with you. So you can call them daydreamers in the low category. Or there can be people, who have not negative body language. You can make out that they are not interested. They'll be rocking in the chair like this, but they will not say you anything. They'll not disturb you directly, or they will not participate. They may even use their phone. They may enter late and leave early, or they may enter frequently and leave in between for a couple of times. And especially in online program, you will see, in spite of your repeated request, they will not have their camera on. But these are all low degrees of disruption. If you are smart, you can actually you can overlook that if majority of the program is going well. If there are 1 or 2 people, you will try to engage them. Of course, I'll be talking them how to engage them, but then you don't have to focus all your energy and time on them. आप बोल क्यों नहीं रहे, आप बोल क्यों नहीं रहे, आप जवाब नहीं दे रहे, आप कहाँ पर हैं? No, there's no need. I mean, you can even ignore them. That's also one of the ways to handle them. But the moderate kind are people who would not only be interested in learning, but they don't mind disturbing you and also disrupting you. So in the moderate degree, you will see they will verbally come out with disagreement or distrust. They will kind of express clearly. what you're saying is not right. Come and see what is happening in reality. So that means they are not agreeing with you and they are not trusting what you are saying. They may even start talking to their left or right person. What she's talking is not meaningful. This is all useless. This is all theory. Nothing happens in practical. So they will do side conversation. And you can make out, and then they'll say something, others might laugh, and you will ask, what is it? They will not tell you what it is. So, and unfortunately, it's very difficult to stay focused on what you are talking, because you are now constantly, disturbed by their some sound which you are not able to exactly understand, but then that's disturbed. And then, of course, in between, they may also pass some sarcastic comments. So this is definitely a moderate degree of disruption. We have to learn to handle this. We'll be talking about in a minute. Then is the high degree of disruption. In the high degree of disruption, they not only are not interested, not only they don't agree, but they can even display anger and aggressive behaviors either towards you or towards other participants. They may verbally say something very disrespectful either to you or to their fellow participants. They may even dramatically exit from the training. They may say, oh, what you're talking is nonsense. I don't want to attend this program. I can't waste my time on it. And they might go out. They may even threaten either you or to your or other participants. And they may actually, pass very nasty comments on you or on your fellow professional. So these are all, different kind of, disruptions that you can experience. I think one thing that we have to remember, please do not take anything personally. If they are behaving like this with you, they are that kind. They not only with you, but in their own personal and professional life, they'll be more or less like this only with their fellow professionals. So don't take their behavior personally. In such situations, avoid arguments, learn how to smartly handle those, these people. Sometimes even, trying some empathy will help. You never know, maybe they are actually very upset with the way they have been managed by their management. So they are getting an opportunity to vent out there. Of course, that's not the right platform and you can't allow that. But there's a possibility that they're really frustrated with the way the whole management is running the show. So you will have to really, understand. And then as I said, we have to be very careful in picking what we are going to, respond to or what we are going to handle. So if we can categorize all these, disruptions in few interesting titles, and we will discuss slightly. Let me show you these a couple of slides where we can discuss about different categories and how we have to handle them. And allow me to share my screen. Give me 1 second. Yeah. So one of the category that we can, call is talkative. So these are the people who would actually comment very often, or usually they may take much longer than others to explain their point of view, and they may even dominate the discussion. So how do you handle such people? What do you think would work for them? People who do a lot of talking, or they normally dominate the discussion and don't let others share their learning.
What I usually do is, that was a wonderful perspective that you're saying. Let me ask the question to the group or the other members of this group. So let's, or I will pass on and ask questions from the other participants, or the other way, when they start too much, is it okay if I pass you for a moment? We will collect all the answers from the group, and then I'll come back to you later on. And I always make sure that at the end of the asking other participants that to come back to them and ask, I'm sorry for the interruption that I have done, but can you now share your thoughts so that we can finalize or collate all the thoughts on this discussion? So that gives them a sense of comfort or feeling that they are being listened to, and at the same time, the entire discussion has been happened in a proper way.
Wonderful. Thank you. Anybody else who would like to share their experience or understanding?
So, ma'am, as a part of in a session, as a part of the fair practice, everybody should get a chance. So, if someone is constantly dominating with the comments or again and again replying, so the person can be appreciated. Yes, he is ready with the answer, but let's try with someone else.
Very nice. So, especially you can't say that let others answer. You have answered all the questions. So that means somebody was answering, I think, after you, Anandita. Anybody has something to add to what Anandita and Dr. Som has said?
Yes, please.
Yes, go ahead.
I just trying to organize the time frame.
Mhm.
Every member should get 5 to 7 minutes like
Mhm.
this, and everyone has to completed this his conversation within this time frame.
So again, Dr. Razak, what happens when you are dealing with a senior and adult audience? It is very difficult to tell them your 5 minutes are over, please stop. That becomes a challenge. So I think you have to be really very smart at first of all identify people who are actually into a lot of talking. So in this situation, first of all, of course, as Anandita also said and Dr. Som said, that recognize their contribution and then assert that others must have chance to speak. Thank you so much. I think you gave a wonderful answer. Let me ask others, what do they say? So that means this person knows that I have to now end it here. Another good way is target the question to other participants by name. So if you call others by name and say, okay, what do you say, Dr. Bijoy? So that means everybody knows Dr. Bijoy has to answer it. Or what do you say, Anandita? So everybody knows Anandita has to answer it. So it's always good to target the question by, calling the person's name so that others know that they don't have to answer. In a physical setup, you can also avoid making eye contact with the person who does a lot of talking. So look at the other side. Don't look at that person. That person would want to talk, but that person will only start talking when you will make eye contact. If you don't make eye contact, that person might start. But then if you're not looking at that person becomes quiet, waiting for you to make eye contact. So very, mindfully, you will have to actually avoid making eye contact with that person. And then of course, if the person is doing lot of talking, the moment person pauses for a second, for example, taking a breath, hang that person and call another person to come in. Okay, what do you say? So that way you can actually take the mic or in a sense to another person. So it's very interesting and challenging to stop people because people have a lot of experience. They want to talk. Another kind of disrupting behavior that you will come across is the people who have do sidebar conversation. They will not talk to you, but they'll be chatting between themselves, either on the left or on the right. They will be engaged in discussion, and it becomes sometimes very difficult to really stay focused because you can hear something but you don't know what they are talking. So how do you handle these situations? Anybody else, Aparna or Raminder or Jenna, how do you think you will handle a person who is into a lot of sidebar conversation?
And we'll ask
We
for
would
his
question.
opinion, something like that.
Sorry, Bijoy, come again.
Ma'am, we'll ask for his opinion regarding the topic which we are discussing, something like that, by calling his name.
Yeah. So maybe you directly ask a question, calling that person's name, so that person will know that I have to answer it. Okay,
Answer,
that's a
yes.
good, interesting way. Jenna, I think you wanted to answer.
Ma'am, I was about to say the same. Talk to the person who is basically discussing something else with the
So you have to engage them. Actually, you have to basically engage them.
Yeah.
Anybody else who would like to, add an additional point to whatever we are mentioning here?
We have to be really assertive on this and appreciate and make the person realize that this session is for a cause and one has to pay attention and we have to be
Anandita, nahi, especially if you are dealing with people who can walk out, they will walk out.
okay.
Then they will further get disengaged. Please be careful because we are not teachers here.
Okay.
Even when you assert, the assertion has to be respectful, polite.
Yeah, in a
What
polite
I
way.
normally say, see, if you are talking between you, I don't get to know what you're talking, but then I'm getting disturbed because I'm not carrying any notes in my hands.
Okay.
And my flow of session gets disrupted. So can I request you not to do this? But again, that assertion has to be very, very polite and respectful, especially if it's an educated professional group. They will not take your assertion because they believe that you are dictating your terms and conditions. So please
Right,
be
ma'am.
careful when
Noted.
you're using
Okay, ma'am. Noted.
so I think one of the ways, like you said, is invite them to share their learning or their experience. So invite them to talk about what, like Jenna said, and like Dr. Bijay said, that you ask them, okay, what do you think about this? What is your idea about it? So automatically they will get engaged.
Like asking for their
Also,
views.
yes, sir. Please go ahead.
Asking for their views.
Asking for their views.
Their own views.
Yeah. Ask them to give their views. So naturally, either they will get to realize or they don't even know what the discussion is about.
Right.
Then they'll become more alert, or maybe they will be actually listening, but then they will answer, but they will get engaged. And again, and here you can use humor also. Oh, I didn't know that you are listening, but you are very smart. You are talking to your colleague, and then you were listening to what was happening. So you have used humor to make that person realize that you are disturbing. Another good way that I often use it, when two people are constantly talking, I would just stop and there'll be pin drop silence in this session for a couple of seconds. So this alerts the other person that okay, I am not behaving as per the expectation. And that's another way to make them quiet, because when they are talking and others are busy, they are also busy. But when everybody is quiet and they are talking, they get noticed. So it's like we say, you throw light on them and then make it obvious to them. Then another way is, of course, restate the point that is being discussed and ask them for their opinion so that they can get engaged. That's the way to engage. Another category of disruptors are interrupters. So interrupters are people who want to either always agree with you or disagree with you or make another point. They'll have something to say, but they would definitely interrupt what you are saying. No, I don't agree with you. Yes, I agree with you, but I have another. So they will always have something to add. So when you are handling this kind of group of people, first of all, right in the beginning, if you can, write down the outline on a flip chart or a whiteboard that these are the things that we are going to cover, and then let them know that by the end of the session these things will be done. And in between you keep reminding them, see, I know we all want to discuss, but then we are just left with 45 minutes and there are a lot of more points to be covered, so I think we need to hurry up. So in a polite way you are saying that we have to cut short the discussion. Or also right early in this session, you can tell them, in case if you think they're asking a lot of questions and a lot of interruptions that they're saying or comment, you can say that I request all of you to note down your comments and questions. Last 15 minutes will be spent on your questions and discussion. So again, they will know that 15 minutes will be given, but we cannot disturb the session. Again, you have to keep them engaged by asking, to complete an interactive learning activity. So when they're busy doing something, they definitely, we hope that they will not ask a lot of questions and make a lot of comment. You can also engage the interrupter to complete a specific task with you, like Dr. Som was mentioning, that make them as your co-facilitator or a co-resistant. So automatically they will become, they'll get engaged with your work and they'll disturb you less. There's another category called arguers. So arguers are people, who think that they are expert or they know more than the facilitator. So they will always have something to, fight over or argue over, or they enjoy actually correcting others. So they think that they know more, the facilitator does not know much. This will come often, but I think again we have to learn to handle, this category of people, especially if they are older in age, they are higher in position, they can do this for you. They can disturb you, or they can actually, like I said, I shared my experience where he said, this title is wrong, this title is not okay. So I think best way to handle this category of people is, acknowledge what they are saying, and then thank them for contributing. And then there's no need to go on arguing and fighting with them. So find what merit you see in their argument, and then express your agreement and move on. And even if you don't agree with them for something, I think you can say, okay, I'll consider it. I'll definitely think about it. And sometimes when you think that that it's not making sense and what this person is saying is absolutely not in tune with the session or topic, so maybe you can paraphrase their comment in a objective manner and then ask them, you said this, what exactly you mean by saying this? So when you ask them, that means you are asking them to asking them to give some evidence or some supporting statement, which probably they will not have. So again, they will realize that they have unnecessarily made an argument and it has no meaning. Then of course you can ask someone from the group to comment or share their opinion. And once you see somebody is not agreeing with them, they will also automatically get quieted. Another category, of course, which you often will get to see is called silent type. And we know silent type are the people who will just be sitting there. They will not, open up. Reason could be anything. Maybe they are shy, they are insecure, they are indifferent, or they are uncertain. But you will see them often, there will be handful of people who would just be sitting there quietly. So again, to engage them, I think it's very important that you ask them a question which you think they can definitely answer. So don't ask any difficult or technical question to them. Ask simple question which you think they will be able to answer, especially from their workplace, from their situation. So they will definitely know. For example, if I have a staff from front office, and if I'm talking to them, and if I say, see, I'm sure you get, people who would come and request you for something that's not doable. How do you handle that? So these things this person must be definitely doing or handling. That way, not only that they will start speaking, but they will also be happy to share their experience. So if you want to ask everybody to answer one question, so ask a question and say that, okay, everybody will tell about their experience, but never start from them. Start from people who you think will be able to answer. So seeing them, these people would start responding. And whenever they speak or whenever they respond, always appreciate them for their contribution. So that's how we have to handle people who are, silent type. Now coming to the set of people who are in habit of using their phone or their laptop, this happens in progress. Very often this happens.
Very often.
Yeah, either they'll be on a WhatsApp message, sometimes even on social media, on LinkedIn, on Facebook, on WhatsApp. I mean, you will see them busy. So honestly, you can actually set clear expectation. What do you expect? So for example, if you say, I request all of you to put your phone on silent mode, only if it is urgent, please go out and take the call. Otherwise, avoid taking the call in the program. So what you're saying, you are clearly setting the expectation. And then of course, make sure that your strategies to engage them are so solid that they don't get a chance to think of, opening their phone and social media. A lot of time you will have to ignore and move on. As I said, if it is one or two people who are just doing it for the heck of doing it, you can actually let it be and not, waste your energy and time on them. So the idea is that we have to, as I said earlier also, don't take it personally. These people are there, they are like this, they will behave in the same manner in most of the places. So it's not you who have to get upset, oh, my program is not good, my session is not good, I am not being respected, these people are no, all that is not required. Don't overthink, don't take it personally, avoid arguments, pick your battles carefully, try some simple empathy. As I said, you never know what their challenges are. A lot of time what they are saying has a lot of truth in it. So maybe you can't endorse that, but maybe you will have to say, I understand you have some concerns that you want to discuss, but this is not the platform to now I use this very often. A lot of time they will start talking about how the management is not doing their job well. That may be very, very right, but then you can't allow that to be discussed in the program. So maybe you will have to assert at that point, I say, I completely understand there are some issues that must be really bothering you, but I think I'm not the right person to handle this. You should be speaking to your management, and this is not the platform to discuss that. And that way you kind of cut the whole thing short. So this is in nutshell about how do you go about designing a program and facilitating a program, and specifically, how do you handle disruptive behavior? Any questions on whatever we have discussed?
Can you, ma'am, share your experience of any kind of disruptive behavior from the audience? Anything that you can, which you can pinpoint, like,
A lot of time I do get to see, for example, when I work with medical students. So initially they will not be serious. They are not interested because they feel communication, we know how to talk. It's only after they sit for initial 30-40 minutes, they get to realize how communication can lead to medical errors or conflict. So as I said, I initially I stay very calm. I know they will become serious. They will take it seriously. They will understand the importance. And I make sure that I give them the vision that this program is not for, for their present position, but this is for their lifetime. So if you know how you have to showcase them what is in it for the program, for them, they will become interested. So with medical students, this is what I do. With seniors, those who are very knowledgeable, I normally engage them because I know they can actually add value to the program. I make them talk, I make them share their experience, because ultimately the purpose is all of us should learn. For me also, it's a learning opportunity. But then you have to be careful. A lot of time, if you take somebody, if you allow that person to do the talking, there's a risk that your session can be hijacked. But again, at the same time, if you are thorough with your preparation, if you have interesting, engaging activities, questionnaires, discussion point, usually nobody can take your mic. Also, when you are going prepared, your subject knowledge is bound to be more than your audience. That should give us confidence. How much ever learned they are in their own subject of expertise, but this is your subject of expertise. So definitely you will know more than it, and you are better prepared. So that really helps. Don't get into argument with people. Avoid arguing. Never. I never do that. I never do that. As I said that I saw a couple of times, if you get into argument, I have had one experience where I actually went into argument with one of the professors, and it really was a very sad show. That prompted me to work on my training skills. I worked on them. After that, I think I can identify, okay, this person is going to be an interesting person. But I am in my mind, I'm ready to see how I can have to ignore, I have to appreciate, I have to engage, and then after a while that person also. So in one of these programs, master trainer program that I went to do, right in the beginning, one of the senior faculty, he said, "Ma'am, have you worked in any hospital?" That was the question I was asked. I said, "Yes, I've worked in a hospital. My initial 10, 12 years, I've worked in a hospital, and I have fair idea about it. And plus, I run my husband's, eye center. So I do handle patients and staff. So I have fair idea about patient handling." And in the end, the comment after the 3 day session, the comment he said, "I asked this question in the beginning, I disturbed you, but I'm saluting you for the confidence you exhibited and the way you have, delivered the program in a very meticulous manner and confident manner."
Thank you. Thank you.
Only thing is, you don't have to get overwhelmed. Don't get overwhelmed. See what happens. People, this is human psychology I'm talking. Whether it is with students, with your fellow professionals, with your audience, with patients, with your family members. Please remember, we we copy behavior, we imitate behavior. See, when we go on metro or when we go at airport, we are so well behaved. When we are traveling in a local train or when we are traveling on a road, we are very different. We are the same people. Because we observe people doing something and we automatically copy them. Make use of this. If you will demonstrate good behavior, the other person is bound to work on their behavior because they will feel that they are not right. If you are wrong, they're happy. If they are wrong and you are wrong, they're happy. If they are wrong and you are right, there is a cognitive dissonance. Oh, I am not as good as this person. Make use of this psychology. You can handle most of the situations. Thank you for asking that question. Good question. Anything else? If somebody wants to ask or comment or. Okay.
I have
yes, please go ahead.
I have a question. It's like,
please.
If we interrupt, the strategies you told us are all completely valid. And at the same time, I have a question, like when we set the meeting or when we set the conversation initially, we talked in terms of a safe environment for everyone to share. And when we, if someone is chatting a lot, and when we stop speaking and then stare at them for a couple of minutes so that they stop talking, or when someone is interrupting with questions or agreeing or disagreeing with us, and when we move away from them, when they are giving a pause, and then we say thank you, and then we move away from them, won't that stop those participants from participating in the conversation or in the training that we are giving?
See, not really. Why I'm saying this, if you are respectful towards everyone and you are not targeting anybody or you are not hurtful and insulting, people understand that you want to give chance to others also. And when you say, I know you, and I normally, when I'm with my audience and if they are much younger to me, I mean, I would hesitate saying कि मेरे आगे वाले बच्चों को बहुत आता है. I know. आप लोग चुप रहो. मैं पीछे वालों से बुलवाना चाहती हूँ. So I make them feel that you're like kids to me, my own children. But I want my children who are quiet, I want them to talk. So was that a disruption for me, Mr. Vijayaraj? No problem. Okay. But I think that's what I said. If overall your behavior is respectful, you're assertive, you're kind, you're fair, people will not mind for a minute if you don't let them. But if you're constantly not letting them speak, then now they are uncomfortable. There you have to, balance things. Yeah. But appreciation, acknowledgement, that goes a long way in making people feel that yes, they are important part of the group. So should we go ahead with the next topic? And the next topic of discussion is understanding patient's expectation. So I have given a couple of case studies in the course material that I emailed all of you. From page number 33, there are a lot of case studies I have shared. Actually, case studies are a wonderful way to, have discussion and see different perspectives and also think deeply about a situation that sometimes we may not take very seriously. So I picked up first case study for discussion. I'm sharing the screen and all of us should be able to read, but I want one by one, some of you to read a portion of it so that we can read aloud for everyone. Let me share the screen with all of you. And okay. So this is on page number 33, but I'm sure there are more case studies also. So would somebody like to read the first two paragraphs?
Yeah, I'll read.
Okay, Raminda, you will do. Okay, after Raminda, I want Aparna to speak because Aparna hasn't spoken this time.
Yeah, I'll take the next one.
Go ahead, please.
Right after dinner, Abdul Rahman clutched his chest and told his wife Zeenat that he thought he had a heart attack. Zeenat wasted no time getting Abdul and their 16-year-old daughter Katrina into the care and raced to a nearby hospital. Although the ER was quite busy, Abdul was placed into room immediately and attended by Dr. Raghavan and the nurses on duty. After taking the history, the team checked his vital signs, including pulse rate, blood pressure, breathing rate, temperature, and auscultation. All preliminary tests were normal, and Abdul noted that his chest pain had also diminished.
So,
I'll continue.
Yeah.
I'll be back in a while, Dr. Raghavan said. The nurses also left the room, going outside to take orders from Dr. Raghavan. Zeenat held Abdul's hand while he was still lying on the examination table. Katrina began to cry. Dad, this is scaring me so much. I don't know what I would do if anything happened to you. I'll be fine, Abdul replied. I cannot see. I am feeling much better already. I bet they'll let me go home very soon.
So, Anandita, maybe you can read further.
Okay. 2 or 3 times during the next hour, one of the nurses looked into the room, scanned various instruments, and left. Another hour passed, then another. I think they forgot you were here, Zinat said. They know you are fine, or the doctor would be checking on you. I will find someone and see if they are finished with you now. I'm getting impatient, just sitting here and nothing being done, and no one telling us what's going on. Zeenat went to the large circular desk in the middle of the room and asked a nurse if it was all right for Abdul to leave, since they had been in the room for quite some time and nothing much being done. I'll ask Dr. Raghavan, the nurse said. It may be a few minutes. He is into and with another patient. We might as well leave. He is feeling better, and there doesn't seem to be a reason to sit around here, said Zenith.
Okay, Anandita. I think let Jenna speak. Jenna, would you like to read the next paragraph? Jenna, are you there? No problem.
When the nurse saw Dr. Raghavan, she asked him, Dr. Rahman's wife just said that they want to go as nothing is being done. So he must be fine. She thinks that they should leave. That is ridiculous, said Dr. Raghavan, almost shouting. So she is bored and wants to go home. Tell that female that this isn't about her and her comfort. It is about the patient. Tell her no. I am not releasing the patient until we have completed our monitoring and we are certain he is not at risk. Katrina had wandered outside of the exam room moments earlier and couldn't help but hear this entire conversation through the conference room door. She went back to the room and said, Mom, it sounds like the doctor is pretty mad at you. You are kidding, Zinat said. What for? He thinks you want Dad to go home just because you are tired of sitting here and that you don't seem to care whether Dad is well or not. He told the nurse that they were still monitoring him. They are still monitoring him? How did I know? No one has spoken to us for hours. They just left us in that little room, I think. I'll have a word with the doctor. Just as she spoke, Dr. Raghavan entered the room.
Thank you. Thank you, everyone. So is this something very, very regular?
Yes.
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 We look after the patient, but we don't brief the family or we don't explain them. So I always say that it is something like you are doing everything, but you are not updating. So they don't know what is being done. It is something like winking at a girl in dark, which you know, she does not know. So it's important not only to do things, but also update them, to inform them. Now, in this case today, I want to ask you, by the way, why don't we inform or discuss or brief the family? Why do you think we don't do?
Not to panic, not to make the patient relative panic, or
But Anandita, is it not that they are already panicking because they don't know what it is and they're assuming it's heart attack or cardiac condition? So they're already panicking. If you don't discuss and inform and brief them, how is that helping us? What do
maybe
others?
maybe
Yeah,
the
yeah. Go ahead. Go ahead.
maybe the time constraint of the doctor and his team and the nurses.
Okay, that's a good point. What do others say?
Sometimes it could be that a person feels I've got more serious patient to look into, and I've seen the reports, the patient's reports are fine. It's all well settled patient and doesn't need much of intervention right now.
But what is the role of briefing? Why is it important? If you were patient's attendant, what would you want?
Ma'am, can I add one pitch in?
Sure.
Ma'am, sometimes as a point from the doctor's point of view or the nurse's point of view, they take it for granted. For them, it's like maybe it's not the. I mean, how do I say? Means not very important that they have to be briefed, because for them it is a very normal situation which they have been seeing always.
So, Anandita, if I may just rephrase what you said, probably earlier patients never asked for that kind of explanation.
Yes, yes.
They were more than happy if they were attended and they were looked after, they were okay to wait outside. But today
Yes.
we know things have changed drastically. Patients, family, they're very concerned. So they want to know, and especially what is the biggest fear in the patient's family's mind? Death, complication. So you can imagine their minds, the state of mind is not normal or not okay. So all the more important for them to know. Yes, Dr. Bijay, go ahead.
Ma'am, actually, I like to say this was a complete mismanagement from the doctor's side and the nurse's side, because the patient was having a chest pain. The family was suspecting a heart attack. They rushed to the hospital, and doctor initially saw him and did some basic first line investigations. All came out normal. Till that moment, it was fine. But doctor just said, "I'll be coming in a while," and he left. Then nurses, no one just turned to them. They were having lot of their apprehensions, anxiousness, confusions, their doubts regarding his health status. No one briefed them. No one briefed them what is the current status. No one briefed them what they are going to do. Nothing. They were in, the whole family was in complete darkness. So this is not acceptable for them. So they were thinking of to moving out of the hospital.
Or
That's what
maybe they thought there is nothing important being done. See,
Yes.
we are monitoring the patient, even that has to be communicated to the family, isn't it?
Yes.
But a lot of time we think we are doing what has to be done. So what is there to communicate that we are monitoring the patient? And can't they see that we have put the monitor and there are so many machines on him, so that means we are monitoring. How do family know what is monitoring? And then more than that, nobody communicated with the family. Dr. Raghavan went out, somebody talked about time factor. Agreed. Maybe we are short of time, but how much time would it have taken to brief the family that we have done ECG, we are getting some tests done, but we still want to monitor him to make sure that he has not had any silent episode or something. How much time? 2, 3, 5 minutes?
2 minutes.
Just few minutes. But what impact it would have had on the family, on the patient's family, and also patient. So when you tell them it doesn't look like heart attack, but we need to monitor. I think one of the reason why we don't clearly say yes, it is fine or it is not fine, because probably even we want to be sure what we are communicating. Can't we say that I need to further investigate to be more sure that there is nothing wrong? Does that somewhere show that I'm not sure of my diagnosis? I'm just asking. Dr. Som, what do you say?
Many times I feel like if a cardiologist is seeing a patient with this is probably something similar to this Dunning-Kruger. Sorry, it's the Daniel-Kruger effect. Like the doctor knows everything, so he presumes that the patient has come with chest pain, so they should know that they will be monitored and they are supposed to be. They follow the hospital rules and they are supposed to be in the room. So they presume that the patient will follow the rules and then they will be in the bed, and then as and when the instructions are given to the staff nurse, the duty of the staff nurse is to follow. So this can be usually many times at least at my place, the nurses are very good in communicating that if something is, if an ECG is taken, then the nurses will say that even if the doctor has missed, or many times it happens in cardiac ICU, when the cardiologist leaves, takes a round and then leaves or rushes to some other emergency, the nurse will talk to the patient saying that the doctor has gone to the cath lab as an emergency. He has ordered an ECG or an echo, and he has reduced the tablets that you have taken yesterday, and you are symptomatically feeling better, and then he will come and talk back to you. Those sort of reassurances from the staff nurse will make the patient to have a belief or trust over the doctor, the nurse, as well as on the system. So that will help avoid it.
One is that we have actually compartmentalized the communication. We say patient's condition cannot be talked by nurse. I think in our country that's what is the practice. We say you're not going to brief about the patient,
Yes.
the patient and family, because we want the doctor to do it. I think that's how we have divided the work. But other than that, talking to the patient's family, the nurses went inside a couple of times to check the monitor, but nobody communicated. Even simple thing, asking or answering something could have at least made some communication, some dialogue. Of course,
A casual conversation while
Could
looking
have
at the
happened.
monitor will would have helped better.
But unfortunately, the whatever communication Zenith made with the nurse, she changed the
Yeah.
word, and she changed the intention also and communicate. And this happens very often.
Right.
We actually add our own opinion to it, and we kind of contaminate the message and communicate that. And how the doctor reacted to it. Oh, that lady thinks that we are not doing anything and she's getting bored. Tell her it is not about her, it is about the patient. So again, at a professional place, can we conduct ourselves like this? We assume that nobody is overhearing, but then in this case, the patient's daughter was overhearing. So I want to ask you, is this expectation unrealistic by the family to expect to be told, to be explained, or to be at least informed that we are monitoring and we need to keep your patient for at least next 10 to 12 or 24 hours? I think that communication need has to be well understood. Of course, now we are taking it seriously and we are working on it. But again, in a lot of setups, we don't normally communicate this to the patient and the patient's family. So, patient's expectations also change. What do you think is the first expectation when the patient comes in the emergency room?
Somebody should listen to
first.
the problem.
We should attend. Somebody should attend immediately. But with time, expectation change also. So we have to be not only ready to the changing expectation, but also know what needs to be explained or to be said. So just to bring in here, I want to talk about patient's expectation. It's a Kano's model of expectation. Has anybody uh, heard about Kano's model of expectation? Let me share the presentation with you quickly, and then we do a small activity on expectation. Give me 1 second to. There is some kind of sound on somebody's side. You can please mute your device. Oh, either fan or AC. Am I right?
AC.
AC.
AC. I've,
But if it is very hot, you can have your AC on,
no,
right?
not at all.
So you can have it on, but put your device on mute mode.
Okay.
Yeah, sure. So this is Kano's model for managing patient expectation. The first, category of expectation is basic expectations. So what will come in the basic expectation? Can somebody uh, think of some of the basic expectations the patient party will have?
Attending first.
Addressing.
Yeah.
Attending.
Comforting words.
Sorry?
Comforting words, like
Comfortable body. Yeah, yeah. So basic expectations are expectation when the patient comes to your hospital. These are not spoken one. They are never mentioned. It's believed that
Action.
it is going to be looked after. For example, if the patient comes in and the doctor has to be available. So it's something that is basic they will expect, or somebody will pay me attention. So that's a basic expectation. So if they're there, they are required for the patient or the patient party to be satisfied. When these expectations are met, client will not come and acknowledge, thank you so much that you are meeting my need. They are bound to be there. But when these expectations are not met, the client is dissatisfied. So some of the examples of basic expectations is, like you said, reasonable waiting time. For example, if they are coming in the OPD, they have to wait for 10, 15, 20 minutes, they are okay with it. But if the waiting time is 2 hours, 3 hours, and nobody is informing, and even after they have come back, if they've come after taking appointment, if it is a long waiting hour, they will not be happy about it. Or the availability of a doctor, or availability of the staff for paying attention. Also, they being asked by the front desk staff or by the nurse and then by the doctor about the problem, why they are here or what is the reason for their visit, and also to be physically examined. So these are all basic expectations any patient will have, and I think we look after most of these quite well. The second set of expectation is called satisfier or performer. So these are the expectations now we are actually primarily focusing on, because if we are able to meet these expectations, patients are mostly happy with it. Also, when these expectations are not met, patients are dissatisfied. Can you give some examples? Can you think of some examples that we are now incorporating in our service to send our patients happy and satisfied? Can you think of some examples?
Explaining what is to be done.
Okay. Anybody else who would like to add to what Kaminder has mentioned?
Ma'am, I would say there is like when the doctor tells you, like he listens to you and he says, nothing to worry, everything's going to be fine.
So that means some assurance,
Yeah.
communication we get. Absolutely. Even that can be a satisfying experience for the patient. So I think first thing that they look for is welcoming behavior. If your front desk staff, if your security staff, if your overall, support staff is well behaved, they are happy that okay, the staff is very, courteous and well behaved. So that means it's very important to have your frontliners, not only, active and smart, but also welcoming and happy to serve and happy to help. Waiting time is usually one of the problem with most of the patient and their family members. So wherever possible, we must work on reducing the waiting time. Look into your department. Look at the. I will be doing an activity with you in a while. But otherwise, if you will do process mapping of your department, right from the moment your patient enters your area and goes back, the turnaround time, see what steps are unnecessary. Where all can you cut down the waiting time? What can be done parallel to save patients' time? That would be really very, very satisfying to the patient and family, because people value their time, and if you value their time, they are very happy. So whichever department you are, whether it is accounts or it is pharmacy or it is lab or it is indoor or it is OPD, see how you can reduce your patient's waiting time. Also, when somebody attends to them with full attention, they feel that there is somebody giving me personal attention. So I think the whole concept of patient care coordinators or patient care executives or patient relation officer, the idea of having these people do the interface between the patient and the whole hospital is that the patient gets individual attention. Lot of hospitals are now, engaging patient care coordinators, where they are trying to improve the, services for the patient, because patient feels okay, there is somebody who is looking after my needs. So this is another area now hospitals are working on. And then of course, when they go to the doctor or to the nurse or to whomever they go to, when the patient is allowed to talk about their problem and somebody is listening to their problem attentively, they definitely feel very happy. Also, in the consultation chamber, if the patient is allowed to ask questions and if their questions are answered with patience, your patient is going to go back very, very happy. A lot of time when they ask something, and if we don't give them answer or we don't give them a time and opportunity, they feel that they were not able to get clarification or get their doubts clear. And then, of course, if there's somebody who's attending to their needs promptly, so that means it is not just the doctor's conduct, everybody right from the entrance till the end. If you are able to, make sure that patient is attended promptly at every step, patients feel happy, and that is a satisfier that we can create in any system. The third category of, patient's expectation is called delighters. And delighters are when patients' requirements are there, but patients don't expect that will be fulfilled. But when it is fulfilled, it becomes a delight. And when unexpected requirements turn into a pleasant surprise, definitely they feel very happy. So can you think of some delighter services that you are giving in your hospital? Can you remember? Can you recollect that you are providing with where your patient come and tell you, oh, that's an excellent service. I really appreciate.
So, ma'am, in the maternity ward, what we have like after the baby is born, so that maybe the moment the mother recovers, maybe in a day or two, we arrange a candlelight dinner for the parent, the new parent.
Oh, great. Excellent. Thank you. Thank you for sharing.
Yes.
Anybody else who would like to share their what they are doing in your hospital? So I remember, I think in India also now this is a very regular practice in a lot of hospitals. In the maternity ward itself, like when my daughter delivered her son, they arrange for a photographer for the pictures of the newborn with all the you know beautiful background and basket and all props, everything. So this is, I think, now in India also we are giving that service where we arrange for a photographer. I have seen hospitals, uh, bringing cake for the patient in case if it is the patient's birthday or their anniversary. And of course, these are all extra mild things, but some of the good delighters that we can think of in case if the patient's appointment needs to be rescheduled for any reason, inform the patient that your appointment has been rescheduled, the doctor is not available, or there whatever. If suppose if the machine has gone out of order, if you inform them, they will feel that you value their time. Also, in case if the patient is not has not visited or has not come for follow-up, or even if there's a follow-up due and you just remind them about the follow-up, they are definitely going to be very happy that somebody has followed up with them. Also, if you spend little more time asking and addressing their unspoken concern. See, we always focus on the health condition, but health is holistic. It could be their emotional issue or some psychological issue or some financial issue. When you address those concerns, they feel that yes, we have actually received a holistic treatment. And then, of course, if you are able to remember their personal details, if you remember their name or their attendant's name or where they live and how many children they have, what profession they have, even that comes as a delight to the patient family. So I'm giving you a broad three categories. I think basics we have to do, but if we can even focus on the second category, most of your patients will be very happy. But if you can create services where patients' time is valued, visit is valued, you try to reduce their waiting time, you try to reduce their number of visits, they will be definitely very, very happy. I think hospitals are working on it, but we need to really, focus more on it. So, if I may quickly tell you what are the common expectations that they're looked after, and patients actually go gaga over what you do for them. First thing that they expect is communication with the nurses, because nurses are the interface between the patient and the doctors. So we have to really work on it where we make our nurses more knowledgeable, more skillful, more communicative, and actually do the real interface between the doctor and the nurse so that their messages, their information gets exchanged. Of course, they want communication from their doctor. Then they want to know about the medicines. A lot of time they are taking medicines, they don't know what medicines they are taking, what care they have to take, when to stop, what side effects can they expect, or whatever their concerns about medication are, they want to really understand. But we have to have that system where this part is looked after. We expect pharmacy to do it, but we know how medicines are dispensed in pharmacy. I don't think anybody stands and genuinely explains and addresses their concerns. So there has to be somebody who talks about the medicine. Of course, the responsiveness of hospital staff, as I said, communication is not only one person's responsibility. Everybody has to communicate. Then pain management, that's another important thing. A lot of time when we don't take their pain seriously. So for us, maybe 0 to, if on a scale of 0 to 10, if the pain is say 1, 2, 3, 4, we think it's nothing. But for the patient, it can be very, very distressing. So we have to make sure that we attend to even that score of pain very mindfully. Of course, hospitals' cleanliness, quietness, and overall ambience plays a very big role in patient satisfaction. And we have to make sure that we give them a clean and a safe environment. Discharge instruction, that's another element we have to keep in mind. Lot of communication is required when the patient is discharged. It has to be confirmed whether the patient has really understood. And also at the same time, whatever questions and concerns they have, we have to actually make them speak so that you address them. And then, of course, if your overall rating of the hospital is good, it would definitely send your patient very, very satisfied. At this stage, I want to introduce you to a very interesting concept, and that concept is concept of design thinking. How many of you have heard about this concept? Anybody who has heard of design thinking? Design thinking is a concept where we are organizing and arranging our services, keeping the client in the center. So the whole concept of patient care service is actually a product of design thinking. But the problem is, are we really applying this in a real sense? So if I may say, you have a lot of examples around you where the services have been designed and delivered, keeping the client in the center, like for example, Amazon or Uber or VFast, Oyo, Zomato. So these all, different services, they are trying to keep the client or the user or the customer or the consumer in the center, and they are trying to design their services to give maximum benefit to their user. So design thinking has 5 elements. That is, first of all, we need to have a deep understanding of the patient's challenges. If we are able to actually see things from the patient point of view, you will actually have a deep understanding of what is patient's challenge. So let me give you an activity. I want you to give me 1 second to. Okay, give me 1 second. So I'm going to take you to your hospital. And this is an activity on empathizing. You can say that I'm going to take you to your hospital, and this is an activity on empathizing. Give me 1 second. Okay, so have a copy and a pen in your hand. And you need to, again, I'm using a new pedagogy with you, and that's visualization, creative visualization. So we are doing 2 pedagogies at the same time. One is expectations mapping, then is empathizing or empathize, and third is creative visualizing. So it's a merger of 3-4 pedagogies that we are going to work on. So imagine yourself visiting your hospital OPD. Imagine yourself visiting your hospital, you're visiting your OPD, but you are not the hospital employee. You're not working in the hospital. Okay, done? So imagine yourself, entering the hospital gate and going to the parking lot to park your car because you have an appointment with the doctor in your own hospital. So see yourself parking the car. Now come out of your car. You're not hospital employee, so the parking person does not know you. Look at that person's conduct. Look at that person's help or not help. Check were your expectations met as a patient from the parking person. And now rate your experience from 0 to 10, 10 being very, very happy, 0 means not, I'm not happy. Just imagine yourself in the parking lot, parking your car, look at the parking, look at the ambience, look at the overall landscaping of the parking area, or the cleanliness or the comfort of parking, and also the conduct of your person who is managing the parking area. And rate your experience on a paper. Write parking and then write your experience from 0 to 10. It could be 0, it could be 10, whatever it is. How does it look? Is it neat, clean, comfortable, easy to park? Is it organized? Is the parking person helpful, not helpful, or behavior? And you're not hospital employee, so you do not know the parking person. Now see yourself at the reception to confirm your appointment, because you have taken an appointment and you have gone to the reception that, ma'am, I have an appointment, and you want to check whether the doctor is available or not. Now your appointment is confirmed and you are directed to go and sit in the waiting area. But before you sit, now reflect on your interaction with your receptionist. Since you are not hospital employee, so you don't get any priority over anybody. You may have to wait, you may get the behavior all other patients get. Look at the conduct of your receptionist, look at the way she or he talks to you or guides you or answers your questions. Write your experience at reception from 0 to 10. You have been asked to go and sit in the waiting area, and you have been informed that your waiting time is almost like 45 minutes because there are 7 to 8 patients before you. You were there on time, but now you are informed that you have to wait for 45 minutes. It will take at least 45 minutes. Now look at the physical setup of the waiting area, the cleanliness, the presentation, sitting arrangement, ventilation, overall ambience of the reception. Are you satisfied? Note down the challenges that you experience availing the service of the waiting area. Was there a sitting space? Was it comfortable? Was it enough lighted and air, cleanliness, everything, just overall. So again, write your experience in the waiting area. We talked about parking, we talked about reception, we talked about waiting area now. So is it comfortable? Are chairs here comfortable, clean and well placed, and is this enough waiting area? Did you get a place to sit or not? All that will come in the waiting area. Now your turn comes for consultation. After waiting for 45 minutes, you have gone to see your doctor. You do not know the doctor. Doctor does not know you. But imagine the doctor that you want to imagine. You now have your interaction with the doctor. How has been your quality of interaction? Were your expectations met? Were your questions answered? Were you given enough time? Were you heard? Were you given a chance to talk about your problem? Again, you can just write consultation room and score your experience from 0 to 10. Now your doctor has asked you for some blood work. So you go to lab, you are entering your lab. Again, look at the ambience, cleanliness, behavior of your technicians, the person who helps you with your lab work, sitting area, waiting area for lab work, your questions, your concerns, were they addressed? You get some investigations done. Then you go to hospital pharmacy because your doctor has written some medicines. So you go to your hospital pharmacy, write your experience about at the pharmacy. How much time did it take for you to get medicines? How was the behavior? Did he explain you well? Did you ask for some discount? Did you get right answer? Did you ask some questions about medicine? Were your questions answered? All that. Write your experience about the pharmacy. So before you go, you're going back to your car, you feel like using the washroom. You want to use the restroom. So now you are entering your toilets in the OPD. So enter the toilet. You are not hospital staff, so you have to enter patient's toilet. Look at the cleanliness, smell. Is the floor dry? Are the toilets clean? smell, and overall ambience, and overall experience. Write your experience about your restroom. You get into your car and you wait for few seconds before you start your car. Are you satisfied with your visit? Did you have good experience? Can you point out any expectation that was not met and that was unrealistic?
For me, it was a mixed experience because after parking, while I was parking the car, the conduct of the security or the person who is responsible for the parking did not behave well with me. He said, uh, it is a doctor's parking space. You're not allowed to park. Sorry, madam. You have to go across the road and park your car. So I was a little bit disappointed. Then when I entered the reception, uh, my impression was good because the receptionist spoke to me very well. She informed me that your appointment is at 11, but then the doctor will be in 45 minutes because he's busy with some surgery. So her words were very kind, and that soothed me. And then when I sat there, I wanted to engage myself for 45 minutes. So they didn't have a proper kind of news or any information about the doctors running on the screen. So I was kind of bored and I got irritated. But then the receptionist, then she tried to, take me to a corner where there are certain magazines and newspapers, and try to, uh, explain me that why don't you go through these magazines, till the doctor comes in. I was okay with it. Then after waiting for 45 minutes, I had interacted with the doctor. So doctor's experience was very good. He explained me very well. Now after I came out of the doctor consultation room, uh, when he asked me to do some blood work, so definitely the lab had a very good ambience. They were very good towards me, and I got it done within minutes. And then I went to the pharmacy. The pharmacy was little bit, it was not ventilated. It was not a ventilated place, so it was in the basement. And it took a lot of time for me to get the medicines. So again, my experience, like I was not that satisfied. Uh, then definitely I went to the washroom. Again, my expectations went higher because washroom was very clean and it didn't smell. The floors were dry. So it was a mixed experience for me. So when I came out of the hospital, then again my car was parked across the road. So definitely I remembered my incidents with the parking person, and it was a bit mixed experience for me. Not so good, not so bad.
So I think Aparna has very briefly, described what she went through. I'm sure each one of you will have some experience, some good and some bad. What I did with all of you was I actually introduced you to design thinking and the first step of design thinking, and that is empathize. If you want to develop a deeper understanding of the challenges your patients experience, just visit your hospital department as an outsider. Each one of you, I give you this task to visit your department not as a hospital employee, but as a patient. If you want to really develop a deeper understanding of how do I make my services best for my patient. So I'm sure after visiting your hospital OPD, you must have identified a couple of areas which need to be improved, which need to be corrected. So the second step of design thinking is define. Clearly define the problem you want to solve. There may be 10 things. Maybe you don't want to work on all 10 things in one go. But you pick up, okay, this is something I can do in my capacity. This is something I need to speak to management. This is something I need to engage more people. So try to see what is doable, what is easily correctable. So kappa will be a wonderful tool here. Take actions that can help you improve your services. So continuous quality improvement. So, but for that, we need to first of all articulate what the problem is. Now, once you have identified the problem, for example, in the whole process, you felt my pharmacy services are not good. So that you have identified, I need to improve the pharmacy services. Or you feel my waiting area is small. The visitors, number of visitors are more. Or my waiting time is very long. It could be anything. So define that problem. And then the third step in design thinking is ideate. Ideate is creating ideas. Creating ideas. So at this stage, I want to introduce you to a very interesting tool called Create. You can write down in your copy. Have I discussed this earlier? Have I discussed this earlier with all of you?
No.
So please write down Create as a capital word. CREATE. It's a acronym. Create is an acronym. I'll explain to you what it is. So it is 3 steps. Create CR. CR is current reality. So when you're defining a problem, you are actually defining what is the current reality. EA. EA is explore alternatives. So that is ideate. So when we ideate or when we explore alternatives, you look for various solutions that you think will work to solve this problem. So you brainstorm, and it should be done by a group of people who are not only from the same department, but also from different department and different professions also. For example, for your services, most of the hospitals are using, hotel employees to give hospitality services to their patients because they feel clinical part we can look after, but we are not good at hospitality. So for that, they are hiring people from hotel industry who are good at arranging hospitality. So you create ideas, you create alternatives. And in that, there are 2 steps. One is mining and second is shining. So mining is dig out as many ideas you can take out. That is mining. So when you ask people to brainstorm, a lot of ideas will come up. Ask them to write their idea and put on the whiteboard. Take those stickies, ask them to write what they think can work as a solution. So make them write ideas. They don't have to write their name. So you create ideas. That is mining. Then as a group, you pick up each idea and then you see how feasible it is. You look at the feasibility, or you look at the relatability. So what you're trying to say is this idea going to work for us or not? You are shining the idea. And then out of those 5, 6, 7, 8 ideas, probably you will be able to identify 1 or 2 ideas that you think will definitely work. And that is prototype. That means you thought, okay, to reduce waiting time, I think these are the couple of steps that we can follow. And everybody agrees to it. Okay, these are the good steps that we can follow. So you create a prototype. So in that acronym, create, current reality, explore alternatives, TE. TE is tap energy. That means give your 200% to make that solution work. And that is test in the design thinking language. That is the final step. So that one particular idea or 2 ideas that you think should solve the problem, you apply them in small area. You don't completely apply in every department, but you try in that particular small area. So what you're doing, whatever new idea that you have been able to finalize, when you apply, you get to see whether it is really helpful, whether it is really bringing the result you want. And that is testing the idea. So design thinking is a beautiful concept, but I think the first step is very important. If you are able to do that, trust me, all other steps will fall in place. We have to look at the problems from the patient's point of view. See, we as patient hospital employees, we get a lot of privileges. We enter any area, we get everything done, we get priority over others. So we don't get to see the hardships our patients face. And if you are able to apply this, I'm sure you can, you know, you can meet your patient's expectations. So the hospitals designs are changing. I remember my first experience with the new style of patient care was at Escorts Hospital almost like 35 years ago. I'm talking about 87, 88. I went visiting one of my relative in Escorts Hospital, and I was very surprised to see a large waiting area, you know, and a coffee shop and a gift shop and you know, all sorts of lounges for the patient attendant. And to me, honestly, it appeared like unnecessary services. But I think people who designed these services, they thought more than the patient, it is the family who requires these help because they are the one who suffer a lot. So even in government hospitals now we are creating waiting areas for family members or dormitories for relatives who are coming from an outstation, you know, place, because we know where do they go, where do they live. And we are creating canteens for them so that family can get food at a reasonable price, or places where they can, you know, refresh themselves. So that's how we have to, you know, understand patient expectations are increasing. There is no doubt about it. But then if we want to stay updated, we need to update ourselves. That's in a nutshell about understanding patients' expectations. Questions, comments, feedback, anything you have to say on this?
Design thinking was a very good exercise.
It's a good. See, talking about problem is not enough. So telling you these are the expectations, I want to give you a solution to work on. So design thinking is a wonderful tool if you will try applying in whichever place you are. Try designing your department using design thinking, and you will see improving, you know, 1% every day. Any questions? Any comments, feedback? Why I kept this topic in the program is we normally think patients' expectations are unrealistic and they're very demanding. That's not true. They have their own reasons for asking those services. And if we were patient, and if our family member was a patient and we were attending, even we will have same expectation. When you will look at the situation from their perspective, you will understand that the only thing is we are not ready to meet those expectations where we need to prepare ourselves. But otherwise, these expectations are not unrealistic. We have to find ways to resolve those. So if there are no questions, I will close the session here and I will send the feedback form in the WhatsApp group. I request all of you to give your feedback by tomorrow evening, maximum by tomorrow evening. Should I close it here?
Yeah.
And also those of you who are presenting in the next session, please prepare your PPT and share with me. And those who have not entered their name, I have just seen 5 names in the list of topics. Rest of you have not entered your name. Please remember, this is one of the requirements to claim your certificate. So don't take it lightly. Thank you. Good night.
Night.
Good night.
Good night.